One of the biggest challenges in medicine is trying to figure out exactly where a stroke happened just by looking at a patient. So in this explainer, we're going to build a mental map to do just that. We're going to turn this really complex puzzle into a clear, sharp diagnostic tool. Let's dive in.
So, let's start with the classic scenario. I want you to imagine this. A patient is right there in front of you. They can follow all your commands, they nod, they understand you perfectly, but when they try to speak, the words just won't come out. So where in the brain is the problem? The answer to this is the very first pin we're going to place on our map.
Answering that question is our first step. So let's start by mapping out the brain's territory for something we all use every day: language.
Well, for the vast majority of people, we're talking about 95% of right-handers and even 70% of left-handers, all the important language centers are located in one place, the left hemisphere of the brain. This is exactly why you'll often hear it called the dominant hemisphere.
And there it is, the answer to our puzzle, Broca's area. It's this spot in the frontal lobe that acts like the brain's engine for actually producing speech. So when it gets damaged by a stroke, you get something called Broca's aphasia. Now here's the crucial point. This isn't a problem of confusion, it's a motor problem. The patient knows exactly what they want to say, they just literally can't get their mouth and tongue to form the words.
And this really shows why anatomy is so critical. See, Broca's area is tucked right behind this specific spot on your temple called the pterion. It's where 4 skull bones meet, and that makes it the weakest point of the whole skull. A direct hit right there can fracture the bone, tear the artery running just underneath, and cause a really nasty brain bleed that puts direct pressure on Broca's area. And that, my friends, is a neurosurgical emergency.
Okay, so if Broca's area is for speaking, what about understanding? Well, for that, we need to meet Broca's partner in crime, Wernicke's area.
Wernicke's area is all about language comprehension. And here's a connection you absolutely have to remember. Both of these vital language centers, Broca's for speaking and Wernicke's for understanding, are fed by the exact same blood vessel, the middle cerebral artery, or you'll hear it called the MCA. Seriously, burn that name into your brain. It's going to be really important later.
All right, now we get to the brain's arterial map. Knowing these arteries is the key to diagnosing strokes, and trust me, there's a simple, maybe slightly weird analogy that makes it incredibly easy to remember.
Okay, I want you to picture the brain as if you're looking down on it from above. Now imagine a little stick figure person just hanging upside down, with their knees hooked right over that big dividing line in the middle. You got that picture in your head? Good, because that one single image is the key to telling apart the major types of strokes. Let's look at our hanging man. His legs and his feet are covering the inner or medial surface of the brain. That whole area, that's the territory of the anterior cerebral artery, the ACA. Now, look at his face and arms. They're draped over the outside, the lateral surface, and that's the territory of the middle cerebral artery, the MCA. It really is that simple.
And this is where it all just clicks into place. The symptoms you see in a patient literally tell you which artery is in trouble. So if your patient has weakness in the leg on the opposite side of their body, maybe with some bladder issues, you should immediately be thinking it's an ACA stroke. But if the weakness is in the face and the arm, especially if they're having trouble speaking, well, that is a classic MCA stroke. The anatomy perfectly predicts what you see at the bedside.
So, we've mapped the major brain territories, but how does information actually get routed to the right places? Well, that job belongs to the brain's very own grand central station, the thalamus.
The best way to understand the thalamus is to use this analogy. Just think of it like one of those old-school telephone switchboards. An input comes in, sound, light, sensation, and the operator, that's the thalamus, plugs that signal into the correct output on the brain's surface, the cortex, so it can be processed. It's the ultimate router.
Okay, this slide is pure high-yield gold. It shows the key connections on that switchboard. VA and VL handle movement, VPL and VPM handle sensation. But the two you absolutely cannot forget are these. The LGB, that's the lateral geniculate body, just think L is for light, that handles vision. And the MGB, the medial geniculate body. M is for music, that handles hearing. These connections are the bedrock of how we experience the world around us.
Okay, it is time to put all the pieces together. We have our map of the cortex, we have its blood supply, and now we have its wiring diagram through the thalamus. With all that, we can start acting like clinical detectives and begin decoding the major stroke syndromes.
Here is a really powerful diagnostic clue.
If a patient's symptoms are all on one side, let's say weakness in the left arm and the left leg, the problem is in the opposite side of the cortex, high up. But if you see crossed signs, where the facial symptoms are on the opposite side of the body's symptoms, that mismatch points you straight to a problem much lower down, in the brainstem.
So after all that detective work, we can now boil it all down into a concise and powerful clinical cheat sheet. This is the big summary, the stuff you really want to walk away with.
And here it is, your clinical cheat sheet. Weakness mainly in the opposite leg? You should be thinking anterior cerebral artery, the ACA. Weakness in the opposite face and arm, especially with speech trouble? That is screaming middle cerebral artery, the MCA. And what if the problem is purely visual? Like they can't see anything on one side. That points to our third major player, the posterior cerebral artery, or PCA, which supplies the visual cortex way at the back of the brain.
And just like that, you have a powerful tool. By understanding the brain's functional areas and their blood supply, you can take a jumble of clinical symptoms and actually pinpoint the problem. You haven't just learned a bunch of facts. You've learned how to read the brain's map.